Thanks, Concorla. Minister, this question relates to the oversight, or rather the lack of oversight, that seems to exist with those who provide care in people's homes, be it of basic medical care, but also monitoring of people. You're talking about people who are sick and elderly, and it appears to be a system to which nobody is accountable for. So I'm wondering what improvements you intend to put in place.
Thank you, Minister.
For her question, and I think, if I'm not mistaken, Yas Concorla, that we're proposed to take questions 106 and 101 together.
Thank you.
Question in the name of Deputy O'Donovan. The Programme for National Recovery 2011-2016 commits to developing and implementing national standards for home support services, which will be subject to inspection by the Health Information and Quality Authority. Primary legislation and resources will be required for the introduction of a statutory regulation system for home care services. This is being considered in the wider context of the licensing of public and private health service providers. I would like to emphasise, however, that there are effective measures that can be applied pending statutory regulation, and the HSE already applies a high level of quality control and supervision to the services provided by external providers with HSE funding. The HSE's procurement framework for home care services includes quality and screening requirements. Providers of home care services are monitored through service-level agreements with the HSE. They are required to provide a prescribed range of information in relation to the services they provide, and are supervised through regular local operational meetings and reviews of clients' care plans. The following areas are included in this context, Ilas Concorla: principles of service delivery, confidentiality, complaints procedure, consent, staff training, governance and management, and workforce-related matters. The purpose of these measures is to promote quality and safety and to ensure a more standardised approach to service provision nationally. Audits are completed and quarterly reports are requested and reviewed. Supporting this is the ongoing monitoring and review of individual clients and their care by HSE professionals such as public health nurses. Home care services are reviewed regularly by the HSE. In addition, the HSE has in place a complaints procedure that is available to all service users. I would like to assure the Deputy and Deputies that complaints are monitored as an indicator of quality of care provided, and to ensure the client's needs continue to be supported.
Deputy Daly.
Thanks, Concorla. Well, listening to the Minister's response, you would think the system had a mechanism in place for dealing with this. Unfortunately, in my experience, that is not the case. Now, I'd like the Minister to maybe explain where we are with the legislation and the statutory improvements which I believe are necessary. I've had two very serious cases brought to my attention recently. One, a woman who was released from hospital with a terminal condition, whereby some facilities were provided by a HSE-funded service, but others were a package which she got from an organisation but which she paid for herself privately, and which was outside the scope of monitoring as a result of that. The woman had paid, and paid handsomely, to have somebody residing in her home at night to be awake if she needed them, and sadly her experience was that in many instances she was left calling for that home care worker, getting no response, being left in soiled bedclothes overnight and so on. And everywhere that complaint was taken, nothing was done about it. So it seems to be the case that those that aren't funded by the HSE seem to be outside the remit of regulation, and I think it is an area that needs particularly close attention.
Well, first of all, Yas Concorla, in relation to the legislation, and as I've indicated to the House, primary legislation is required and is intended to be brought forward for the introduction of a statutory regulation system, which is of course the most secure and the best way to address the reasonable issues that the Deputy raises in the House. A regulation system for home care services, and the programme for government gave that commitment, and the Deputy will be aware, and this is not for a moment to downplay the importance of this issue that she raises, because it is of huge importance to individuals and their families, as the Deputy has rightly said, that there is quite a volume of legislation being addressed within the Department of Health at this time. We're looking at the licensing more broadly of public and private health service providers as a broad piece of work, and legislation that is needed in this context in relation to home care and home health is being brought forward and is being developed in that context, in that broader context of that licensing process.
As I appreciate there's a heavy workload, but you're more than halfway through your term, and sadly the woman I was talking about died, and her family are left with the legacy of feeling an indignity in her remaining weeks and months at home. And they went everywhere, already coping with their loss, to try and get an explanation for why the service they paid for so expensively didn't allow that woman to remain at home in dignity. Only last night I heard of another couple who've decided now to move in to a nursing home, but what was decider was the man woke up last night to see a rat at the end of his bed. Now these are an elderly couple which have home care providers coming in to mind them. A rat doesn't just appear out of nowhere, and the idea that that was allowed to happen in a home means we really urgently need a regulation in this area for basic human dignity, to be honest, not to mind the amount of money that's been spent on it.